Okay, deep breath. Are you ready for this one? Welcome back, everyone. And if you're new here, welcome to the family. This channel is dedicated to one thing, helping you understand real English in real situations. And today's situation is one I've been planning for a long time. We are going to the emergency room. Now, I want to be honest with you. This episode is harder than anything I've made before. Medical English is specific, formal, and emotionally intense. The vocabulary is more complex, the conversations are longer, but I want you here precisely because of that difficulty. Because the day you need this English, you won't have time to look things up. You need it already in your head. So today, we go deep. Here's what we're doing. We start with 15 vocabulary words, essential medical terms you simply must know. Then 3 conversations, a patient being admitted and triaged, a full doctor's assessment, and a detailed discharge conversation. After that, 8 expert listening tips. Then something a little different from our usual challenge, a gap fill exercise where you fill in the missing words from the actual conversations. Then a role play section where you take one of the characters and practice speaking out loud. And we finish with 30 bonus phrases across 6 real-life medical categories. One important note, everything in this episode is for English learning only. It is not medical advice. In a real emergency, always call the emergency services first. In the UK, that's 999. In the US, 911. In Australia, 000. Notebook out, let's go.
15 words. Say each one out loud after me. Pronunciation in medical settings matters. If a doctor mishears you, it costs precious time. Triage. The process of prioritizing patients by the urgency of their condition. For example, when we arrived, the nurse took us straight to triage to assess how serious it was. Acute. A condition that is severe and comes on suddenly. For example, she was brought in with acute chest pain that started about an hour ago. Symptoms. The physical signs or feelings that indicate something is wrong. For example, the doctor asked him to describe his symptoms in as much detail as possible. Vital signs. The key measurements of bodily function, pulse, blood pressure, temperature, breathing rate. For example, the nurse checked his vital signs every 30 minutes throughout the night. Intravenous, IV. Medicine or fluids delivered directly into a vein through a needle and tube. For example, they put her on an IV drip to keep her hydrated while they ran the tests. To prescribe. When a doctor officially authorizes medication for a patient. For example, the doctor prescribed a course of antibiotics and a painkiller. Allergic reaction. When the body reacts badly to a substance such as food, medication, or an insect sting. For example, he came in with a severe allergic reaction after eating shellfish. Fracture. A broken or cracked bone. For example, the X-ray confirmed a hairline fracture in her wrist. She would need a cast. Concussion. A mild traumatic brain injury caused by a sudden impact to the head. For example, after the fall, the doctor diagnosed him with a mild concussion. Discharge. When a patient is officially allowed to leave the hospital after treatment. For example, the doctor said she could be discharged this evening if the scan came back normal. Next of kin. The closest family member or emergency contact for a patient. For example, the receptionist asked for the patient's next of kin in case they needed to be contacted. Observation. When a patient is kept in hospital to be monitored without a specific treatment. For example, they kept him in overnight for observation just to make sure the bleeding had stopped. Consent form. A document a patient signs to give permission for a medical procedure. For example, before the operation, she had to read and sign the consent form carefully. Prognosis. a doctor's prediction of how a patient's condition is likely to develop. For example, the prognosis is positive. With rest and medication, she should make a full recovery. Hemorrhage, serious bleeding, especially internally. An intracranial hemorrhage means bleeding on or around the brain. For example, the CT scan was ordered to rule out an intracranial hemorrhage after the head injury. Good. Keep all 15 in your mind. You'll hear them in the conversations. Let's move on.
It's a Saturday evening. Claire has brought her boyfriend Marcus to A&E after he fell from a ladder while helping a neighbor with roof repairs. He has severe pain in his left arm, a cut above his eye, and he's feeling dizzy. Claire does most of the talking because Marcus is in significant pain. Listen to the full conversation first, then read along with the script below.
Good evening. Can I help you?
Yes, hi. My boyfriend needs to be seen urgently. He fell from a ladder about 40 minutes ago, and he's in a lot of pain.
Of course. Can I take his full name first?
It's Marcus Hale. Marcus, Hale, Hale.
Date of birth?
The 14th of March, 1995.
Is he registered with a GP here in the area?
Yes, Dr. Patel at Riverside Health Center.
And are you his next of kin?
I'm his girlfriend. His parents are in Scotland, but I can give you their number.
That's fine. The triage nurse will take all of that. Take a seat right over there, and someone will be with you shortly.
2 minutes later, triage area.
Hello, I'm James, one of the triage nurses. So what's happened today?
He fell off a ladder, about 3 meters up, repairing some roof tiles. He slipped and landed on his left side.
Marcus, can you tell me where the pain is worst right now?
My arm, left arm, and my head. I think I hit it on the way down. On a scale of 1 to 10, how bad is the arm pain? 8, easily. And the headache? Maybe a 5. But I feel foggy, confused, and there's a gap in my memory. I don't remember the actual moment I fell. Did you lose consciousness at all, even briefly?
I don't think so, but I wasn't watching every single second.
That memory gap is important. Are you allergic to any medications?
No, nothing that I know of.
And are you on any regular medication?
Just Ramipril, 5 milligrams, once a day, for blood pressure.
Good. I'm classifying this as a category 2. You'll be seen by a doctor very shortly. If the pain suddenly gets much worse or he loses consciousness, press the red button on the wall immediately.
Comprehension note. Conversation 1. Patient. Marcus Hale. DOB, 14 March 1995. GP. Dr. Patel, Riverside Health Center. Incident. Fall from about 3 meters while repairing roof tiles. Complaints. Left arm pain 8 out of 10, headache 5 out of 10, dizziness, memory gap around the fall. Allergies, none known. Medication, Ramipril 5 milligrams daily, blood pressure. Triage prostration, category 2, urgent. 30 minutes later, Marcus is in a curtained bay. Dr. Amara Ose, a senior emergency physician, arrives to carry out the full assessment. Notice how she communicates, calm, precise, and thorough. Pay attention to how she explains complex medical terms in plain English immediately after using them.
Hello, Marcus. Claire. I'm Dr. Osei, one of the senior emergency physicians here tonight. I've read the triage notes, but I want to go through everything myself. You're in safe hands.
Thank you.
Let's start with the arm. I'm going to feel along your forearm and up to the elbow. Tell me the moment any spot hurts more than another.
Ow, right there, just above the wrist.
That area, yes. The tenderness is quite localized. I want to get an x-ray of the forearm and wrist to rule out a fracture. Given the fall, there's a real possibility of a break.
Is it definitely broken?
I can't say without imaging. It could be a fracture, a severe sprain, or a soft tissue damage. The x-ray will tell us. Now, the head.
The headache is actually a bit better.
That's good. But the memory gap is something we take very seriously. It suggests there may have been a brief loss of consciousness, which means I have to consider a concussion, a mild traumatic brain injury from the impact. Before I let you go home, I need to rule out an intracranial hemorrhage, bleeding on the brain. So I'm ordering a CT scan of your head alongside the x-ray.
A CT scan? That sounds serious.
It's a precaution, not a verdict. It's painless. You lie still for a few minutes while the machine takes images of your brain. If everything is clear, we treat this as a concussion and send you home with instructions. If we see anything concerning, we act immediately. That's exactly why you're here.
How long will it take?
The scan itself is under 5 minutes.
Getting a radiology slot, probably about an hour. While you wait, I'm setting up an IV line for pain relief directly into the bloodstream. It works much faster than tablets.
Yes, please. The arm is really hard to ignore.
Before we do that, any allergies to painkillers?
Morphine, codeine?
I've never had morphine before, so I honestly can't be certain.
Very sensible answer. We'll start with a mild anti-inflammatory and monitor your response. If you feel any itching, swelling, or difficulty breathing after the injection, press the call button immediately. Do not wait. Understood. One more thing. Do you have someone who can stay with you tonight? After a head injury, we strongly advise against being alone for at least 24 hours.
I'll be with him. I'm not going anywhere.
Good. I'll be back once the imaging results are ready. If the headache suddenly gets much worse, or you feel nauseous or confused again, tell a nurse straight away.
Comprehension note. Conversation 2. Arm. Localized tenderness above wrist. X-ray ordered. Possible fracture. Head. Memory gap. Possible concussion. CT scan ordered to rule out intracranial hemorrhage. Treatment. IV line plus mild anti-inflammatory to start. Morphine avoided due to unknown tolerance. Watch for after IV. Itching, swelling, difficulty breathing. Press call button immediately. Post-discharge plan. Marcus must not be alone for 24 hours after head injury. 3 hours later, the results are back. Marcus has a hairline fracture in his left wrist and, thankfully, a clear CT scan. Dr. Assay returns with both results and goes through the full discharge process. This conversation is packed with aftercare instructions, the type of English that is most critical to understand correctly.
Good news and more good news. How are you feeling, Marcus?
Much better. The pain relief made a big difference.
Excellent. The CT scan first. I've reviewed it with radiology, and I can confirm there's no sign of any bleeding or structural damage to the brain. It's completely clear.
Oh, thank God.
I know. Now, that doesn't mean you walk away without being careful. The dizziness and memory loss are consistent with a mild concussion, and those symptoms need to be taken seriously. First, though, the wrist.
Is it broken?
Yes, but it's a hairline fracture, a very fine crack in the radius, one of the 2 main forearm bones. It's undisplaced. The bone hasn't moved out of position, so no surgery is needed. We're putting your wrist in a fiberglass cast for 6 to 8 weeks.
6 to 8 weeks.
You'll have a follow-up at the fracture clinic in 10 days. They'll x-ray it again to check the healing alignment. Now the cast, you must not get it wet, so you'll need a waterproof cover for showering. You must not drive. Don't lift anything heavier than a cup of tea. And if the cast feels too tight or you lose feeling in your fingers, come back immediately.
And the concussion?
The most important thing is cognitive rest, resting the brain. That means limiting screens. No long stretches of television, phone, or computer. Try to keep it to 30 minutes at a time with breaks. No sport or strenuous activity for at least 2 weeks, and absolutely no alcohol.
Not even one drink?
Not one sip. Alcohol worsens concussion significantly and can mask warning signs of something more serious developing. I mean that very seriously.
What warning signs should we watch for?
Come back immediately if Marcus develops a severe or worsening headache, repeated vomiting, seizures, extreme confusion, weakness or numbness in any limb, slurred speech, or if he becomes very difficult to wake from sleep. These are red flag symptoms.
That's a lot to remember.
Which is why I'm giving you a printed aftercare sheet with everything on it, a prescription for a mild ibuprofen-based painkiller to take with food, and a referral letter for the fracture clinic. Call them tomorrow morning to book your 10-day appointment.
Is there anything else?
Just this. If anything feels wrong in the next 72 hours, trust that instinct and come back. Never feel embarrassed to return to A&E. That is exactly what we are here for.
Thank you so much, Doctor.
Take care, Marcus. Claire, you did the right thing getting him here quickly.
Comprehension note, conversation 3. CT scan, clear. No brain bleeding or structural damage. Wrist, hairline fracture of the radius, undisplaced, fiberglass cast, 6 to 8 weeks, no surgery. Fracture clinic follow-up in 10 days. Call tomorrow morning to book. Concussion care, cognitive rest, limit screens 30 minutes at a time, no sport 2 weeks, no alcohol. Red flags, return immediately. Severe worsening headache, repeated vomiting, seizures, confusion, slurred speech, weakness or numbness, difficulty waking. Discharge pack, printed aftercare sheet, plus ibuprofen prescription, plus fracture clinic referral letter.
Before the practice exercises, I want to give you 8 expert tips specifically for medical listening. These are not general tips. These are specific techniques that will help you in a real hospital environment. Tip 1. Listen for Latin and Greek word roots. Medical English is built on Latin and Greek. Haemo means blood. Intra means inside. Cranial means skull. Cardio means heart. Once you recognize these roots, long, unfamiliar words become guessable. Keep a dedicated notebook page for medical word roots. It will accelerate your medical listening faster than any other technique. Tip 2. The pain scale is always coming. In almost every medical conversation, someone will ask the patient to rate pain from 1 to 10. The moment you hear scale of 1 to 10, a number is coming. Your ears should go on high alert. Numbers carry critical diagnostic information in medical contexts. Train yourself to catch them immediately. Tip 3. Recognize red flag language. Doctors and nurses signal their most critical information with specific phrases. When you hear, "I want to be completely honest with you," "This is very important," or "Come back immediately if," or "I need you to listen carefully to this," your brain must switch to full alert. These phrases always precede the information that matters most. Tip 4. Understand the structure of a medical consultation. All medical consultations in English follow a predictable pattern: greeting and introduction, presenting complaint, what happened and when, past medical history, current medications and allergies, physical examination, investigations, tests, and treatment plan with discharge instructions. Knowing this structure means you can predict what type of information is coming next, and prediction is one of the most powerful listening strategies. Tip 5. Never panic when you miss a medical term. If a doctor uses a word you don't understand, say so. "I'm sorry, could you explain what that means in simpler terms?" Doctors are trained to communicate complex ideas in plain language. Notice how Dr. Osei does it throughout these conversations. She uses the medical term and then immediately defines it. Intracranial hemorrhage, bleeding on the brain. If your doctor doesn't do this automatically, ask. Tip 6. Listen specifically for negatives. "There is a fracture" and "there is no fracture" are completely opposite statements. In a noisy, stressful environment, the word "no" can get completely lost. Always listen for negative constructions with full attention. If you're not certain, confirm it. "Sorry, did you say there is no fracture or there is a fracture?" Tip 7. Write during the consultation. Medical discharge instructions are long, detailed, and given when you're tired and possibly in pain. You cannot remember all of it. Always carry a pen and paper and ask the doctor to slow down if they're going too fast. A phrase to use is, "Could you give me just a moment to write that down?" No doctor will refuse this. It shows you are taking your health seriously. Tip 8. Practice repair strategies. A repair strategy is something you say to recover when communication has broken down. Learn these phrases by heart and use them without hesitation. "I'm sorry, I didn't quite catch that. Could you repeat it?" Or, "Could you write the name of that medication down for me?" Or, "Just to make sure I've understood correctly, you're saying," or, "Is there printed information I can take home about this?" These 4 phrases alone can transform a confusing medical appointment into a clear one.
Now it's time to test your listening memory, but not with questions and answers. Instead, I want you to complete these real excerpts from the 3 conversations. Each blank represents one word or short phrase that was spoken in the audio. Here is how this works. I will play a short clip from each conversation, about 30 seconds each. You pause after each clip and fill in the missing words from memory.
If you need to, go back and listen again. The goal is not to cheat. The goal is to make your ears work. Ready? Let's go clip by clip.
How to do this exercise. Step 1. Read the gapped excerpt below. Step 2. Listen to the short clip from that conversation, video timestamps given. Step 3. Fill in each blank from memory. Step 4. Check your answers in the Q&A workbook, link in the description.
Marcus, can you tell me where the is worst right now?
My arm, left arm, and my head. I think I hit on the way down.
On a scale of 1 to... How bad is the arm pain?
Easily.
Did you lose at all, even briefly?
No, nothing that I know of. Just Ramipril. 5 once a day for blood pressure.
The memory gap is something we take very... It suggests there may have been a brief of consciousness, which means I have to consider a concussion, a mild brain injury. Before I let you go home, I need to rule out an haemorrhage, bleeding on the brain.
A CT scan? That sounds...
It's not a verdict, it's painless. The most important thing is rest, resting the brain. Try to keep screens to minutes at a time with breaks. No sport or strenuous activity for at least weeks. And absolutely no.
Not even drink?
Not one. Alcohol worsens concussion and can mask warning signs of something more serious.
This is my favorite part of today's episode, and the one most people skip. Don't skip it. Speaking practice is the fastest way to make new language stick in your brain. We learn best when we produce language, not just receive it. Here's what you're going to do. In the role play below, your lines have been removed and replaced with a prompt. You are going to play the patient, Marcus. You'll read the doctor's line, then pause the video and speak Marcus's response out loud based on the prompt. Don't worry about being perfect. Just speak. Your voice, your words, your English. Role play rules. Read the prompt in brackets. It tells you what to say, not how to say it. Pause the video after each doctor's line and speak your response aloud. Don't read Marcus's original lines. Try to create your own version. After speaking, you can read Marcus's original line to compare. Do the whole role play at least twice. You'll improve noticeably the second time.
The scene. You are in the hospital bay. Dr. Osei has just arrived to assess you. Your left arm is in a lot of pain. Your head hurts, and you feel confused. Speak naturally, as if this is really happening.
Hello, Marcus. I'm Dr. Osei, one of the senior emergency physicians here tonight. I've read the triage notes, but I want to go through everything with you myself. How are you feeling right now? I understand. I'm going to gently feel along your arm. Tell me the moment any particular spot hurts more than the rest. That area, yes. I'll need to order an X-ray to rule out a fracture. Now, tell me about the head. How is the headache? That memory gap is very important. I'm going to order a CT scan of your head alongside the X-ray to rule out any bleeding on the brain. I know that sounds alarming, but it's a precaution. The scan itself is very fast, just a few minutes. And while you wait, I want to set up an IV line to give you pain relief directly into the bloodstream. It'll work much faster than tablets. Are you okay with that? Before I do that, are you allergic to any painkillers? Morphine, codeine, anything like that? Very sensible. We'll start with something milder and monitor your response. If you feel any itching, swelling, or difficulty breathing after the injection, press the call button right away. Understood? Of course. Try to rest. I'll be back with the results as soon as I can.
Role play, advanced challenge. Once you've completed the role play above, try this. Do the full role play again, but this time, play Dr. Osei instead of Marcus. Cover Marcus's lines and respond as the doctor, using formal, calm, clear medical English. This is a significantly harder challenge and excellent practice for medical professionals who need to communicate with patients in English.
30 phrases, 6 categories. Say every single one out loud, even alone, even quietly. Your mouth needs to practice forming these sounds before you need them in real life. When you arrive at the emergency room,
I need to be seen urgently. I'm in a lot of pain.
direct and clear. Don't minimize your pain at the reception desk.
I had an accident and I think I may have broken something.
Use I think or I may have. You don't need to be certain.
My partner collapsed and isn't responding properly.
This signals a possible loss of consciousness. Staff will act immediately.
I'm bringing someone in. They were in a road traffic accident.
Road traffic accident, or RTA, is the standard British English term.
I'm not sure if this is an emergency, but I'm very worried.
Always acceptable. Let the triage nurse decide the urgency level, describing your symptoms.
The pain started suddenly about time ago.
Always give a time frame. It's one of the most important diagnostic details.
It's a sharp stabbing pain, a dull constant ache, a burning sensation.
3 essential pain character descriptions every doctor understands.
The pain comes and goes. It's there all the time.
Intermittent versus constant. Always specify which one.
It gets worse when I move, breathe, press on it.
Aggravating factors help doctors localize the problem.
I feel lightheaded, nauseous, short of breath.
Lightheaded is dizzy or faint. Nauseous is feeling sick. Know the difference.
I'm sorry, could you explain that in simpler terms? I'm still learning English. Doctors hear this regularly and are always willing to simplify.
Could you write that down for me? I want to make sure I remember it.
Completely normal and very sensible to ask.
Just to confirm, you said there is a fracture, there isn't a fracture.
Confirming negatives is critical in medical English.
What does this mean exactly?
Never leave any medical appointment with an unexplained term.
Is there a leaflet or printed information I can take home about this?
Most hospitals have printed patient information sheets. Always ask. Giving medical history.
I'm allergic to penicillin. It causes a rash. My throat swells up.
Always specify the reaction, not just the allergy.
I'm currently taking medication, dose, once, twice, 3 times a day.
Learn the exact name and dose of any regular medication by heart.
I have a history of condition.
History of is the standard phrase for previous medical conditions.
I've never had anything like this before.
Tells the doctor the condition is new, very relevant for diagnosis.
My family member has a history of heart disease, diabetes, or cancer.
Family history can be directly relevant to your diagnosis. During treatment.
Before you give me anything, I'd like to know what it is and what it does.
You always have the right to know what medication you're being given.
I'd like to give my consent, or I'd like more information before I consent.
You have the right to informed consent before any procedure.
The painkiller doesn't seem to be working. The pain is still very bad.
Don't suffer in silence. Medical staff can adjust your pain relief.
I think I'm reacting to the medication. I feel unusual.
Report this immediately. Don't wait until you're certain.
How long will I need to wait? Is there any update on my results?
You are entitled to updates on your care. This is polite but direct. On discharge.
Could you go through the aftercare instructions one more time? I want to be sure.
Never feel embarrassed to ask for a second explanation.
When exactly do I need to come back, and who do I call to arrange it?
Get every follow-up detail clearly before you leave.
What symptoms should I watch for that would mean I need to come back?
Ask for red flag symptoms if the doctor hasn't already mentioned them.
Is this prescription for the hospital pharmacy or any pharmacy?
Practical. Hospital pharmacies sometimes have limited hours.
Thank you so much. You've been incredibly patient and clear.
Kindness is always worth expressing. It costs nothing.
And that is episode 12, At an Emergency Room. Done. What you just did was remarkable. You got through 15 vocabulary words, 3 realistic extended conversations, 8 expert listening tips, a gap fill exercise where you had to recall the exact words from the audio, a role play section where you actually spoke English out loud, and 30 bonus phrases across 6 categories. That is a serious amount of language work, and you should feel genuinely proud of that. Before you go, a couple of important things. First, the free Q&A workbook for this episode is linked in the description. It contains 25 comprehension questions on all 3 conversations with full detailed answers, plus additional vocabulary exercises. Download it, print it, do it. It is the deepest practice available for this episode, and it is completely free. Second, I want to know how you got on with the role play. That's what I want you to comment below today. Not your score, not a number, just one honest sentence about what it felt like to speak out loud as Marcus. Was it awkward? Was it easier than you expected? Did you surprise yourself? I read every single comment, and I will reply to as many as I can. Third, if this episode helped you, please share it with one person who is learning English. Just one. That is the most powerful thing you can do to support this channel. More powerful than any like or subscribe, as much as those mean to me too. Now, episode 13. Here's your teaser. You've just landed in a new city. You don't know the streets. You need to ask for directions, read signs, understand public transport announcements, and navigate your way to your destination entirely in English. Next week, we are going to the streets of the city. Navigation, urban vocabulary, transport conversations, and real directional English. It's going to be practical, fast, and a lot of fun. Don't miss it. Keep listening, keep practicing, keep going. Every conversation you understand is a victory.